Yeah. So good morning. It's very nice to see all the faces and some names, and Michelle Allen and Jeannie Christian and myself, Logan Vaughn, are very happy to be here with you this morning. I'm going to ask Michelle and Jeannie to help me out. I just got a warning that my internet, it just flashed on my screen. So just wave at me if you need to take over.
Okay.
And so that everybody can hear and see properly. We're very pleased to talk with everyone today about ways that you can prepare for the kinds of changes that are coming up in the next year and feel like you're prepared for the changes over whatever the next 10 years bring. This morning, first of all, Jeannie Christian will be pointing out some important Zoom buttons for you to know about today. She'll show you how to mute your line, unmute your line, how to ask a question, and we'll have time for a few questions at the end of this panel. Next, Michelle Allen is going to talk to you about ways to avoid hospitalization and how to plan ahead to make it smooth in case you do need to go to the hospital. Jeannie Christian will talk with you about issues that should be spelled out in your legal documents, especially ventilator options that we've all been considering, some of us for the first time now. So those will be important. And then I'll come back and wrap it up and talk with you for a moment about changes that you should address in your required minimum distribution, as well as ways to make sure that your investments are set up to weather the recovery ahead and to weather future storms. So we are very pleased to get started, and I'm going to turn it over to Jeannie Christian.
Great. Thanks, Logan. Let's see. Am I still on mute?
You're good. We can hear you.
No.
Okay, good. Sorry. Good morning, good noon, good lunchtime. I'm Jeannie Christian with Brandon Napier Elder Law, and I thought I'd go over the Zoom etiquette. That's a new phrase. It's a thing, as my 14-year-old would say. So if you haven't been on Zoom before, it's a hover. So if you get your mouse and you hover, you use your finger and your hover, then you get to see the icons on the bottom. So on the bottom, way on the left, you'll see the mute button and unmute it. So if a train goes by in my neighborhood, I'll probably press mute. If my kids start screaming, which they don't, but then I'll press mute. Or if a dog starts barking, so just kind of be aware of that. If you feel like you need to get up or start doing something really busy, you might want to stop your video like that, because if you're really busy cooking lunch or something, it distracts everybody else from, it just is distracting. If you want to chat and ask questions, you hover over and you can press the chat button. Sometimes it's just a button where it says other. And if you press that, it's going to give you a white line on the right. It'll say to everyone, and it'll say chat. So I'm going to put chat in there in case you're able to check that. Okay. So that's the really basic etiquette. Instead of going with the hand sign on the bottom, there is a reaction sign. I'm just going to say when we're question and answer at the end, Logan or I will either, if you do this, we'll just say, all right, I'll get you. And then that way we're not talking over each other. And then Logan will say, Jeannie will answer that question, or Michelle will answer that question. So if you have any questions during it, you can always chat, during the message, but hopefully that's helpful. I know it's hard if you don't see the icons, but hovering and scooching your mouse around is how it works. Michelle, okay.
That's great, Jeannie. Thank you so much for that. And definitely everybody feel free to use the chat feature and we can follow along with any questions or comments that you have. And thank you so much, everybody, for being here today. My name is Michelle Allen. I'm a licensed clinical social worker working as a geriatric care manager with Aging Life Care of Atlanta. So what I basically do for folks is help them navigate through the long-term care maze. I help them navigate through like medical decision making, hiring in-home caregivers, finding assisted living communities. For some of my clients, I'm their healthcare decision maker, but it's all on like the caregiving side and the healthcare stuff that I'm helping folks with, helping my clients with. And what I wanted to talk to you about today is just giving you an update about what I'm seeing in what's happening in the medical community and in the long-term care community. And of course, tips for staying out of the hospital, because that seems like a terrifying place to be right now, right? You can't, there's lots of extra germs there these days, and your visitors and your advocates can't come into the hospital and see you. So we want to make sure that we stay out of there. So first, a little bit about what's going on in the hospitals. It feels really intimidating to go into a hospital setting, but what I'm hearing is that they're doing a great job of using the right protective equipment.
Hey, Michelle, you're freezing up just a little bit.
Oh no, I'm so sorry. Maybe I'll talk a little bit slower so that if I do freeze, maybe it won't catch all of my stuff. Okay. Thank you, Jeannie, for letting me know. So first, like what's going on in the hospitals? We do want to try to avoid any hospitalizations right now, but should you need emergency medical care, our ERs are still safe places to go, right? So we're seeing a drop in people using ER services for strokes, heart attacks, accidents, all of these other things. And we're wondering as a community, like what folks are doing. So I do encourage people that if you have an emergency to reach out to your ER and to go in and get the care that you need instead of making it wait. And we'll talk a little bit more about that. But then I would also recommend that we know a little bit more about our urgent care providers. I think most of you guys know about the Atlanta Urgent Care Center that's on Claremont, at the corner of Claremont and Briarcliff, right next to the QT. It's owned by Dr. Ferrara, and it's led by ER doctors who are independently owning that building. They're not affiliated with Northside, Piedmont, Emory, or any of the other major healthcare organizations. And they are not accepting anybody into their building who has flu, cold, or COVID symptoms. And so it's actually a pretty safe place to go right now if you needed help with something other than COVID-related symptoms. If you have COVID-related symptoms or cold or flu, they are encouraging you to reach out to them through their telemedicine portal and to get some support that way. But this weekend, I took a client to the Atlanta Urgent Care Center, and it was a fantastic experience. It was very safe. It was very clean. They had nobody in there that had cold or flu symptoms. They have not had anybody in there with cold or flu symptoms, I think they said, since the beginning of March. So that's one thing to know about. So the other thing that maybe you guys are already taking advantage of is using more telemedicine to meet with your primary care physician, right? So what we don't want to do during this time period is stop getting any medical attention at all, right? So you do want to make sure that you are getting the medical attention that you need. We just might need to do it differently. So have you already figured out your primary care physician's telemedicine portal and how to connect with them remotely and maybe do a video session with them? If you or somebody that you know needs extra care, so if you need help with home care, hospice, home health, assisted living care, or nursing home care, all of those providers are still accepting new clients and new patients. It just maybe is a little bit different than it was before, right? So right now I've got 2 clients who are in a nursing home. I've got one client and I've actually got 2 clients who this week are moving into an assisted living community. Another client who's signing up for hospice, and another client who signed up for home health last week. And then a number of clients who still have home care, so who still are having private duty home care through an agency. So all of these providers are still out providing services, and they're doing it the safest way that they can. Most recently, though, I have heard that our nursing home providers are halting their admissions as they reevaluate how many positive COVID residents they have currently and are trying to set up the right procedures and to keep everybody in their building, including their staff members, safe. So I would say that the nursing homes are the one area right now that has really slowed or halted their admissions. And I don't know what that's going to do in the long run. It's going to be really interesting to find out. But most of the nursing homes around us have had some positive cases. I'm trying to think if that's true. Yeah, most of them have had a positive COVID cases. Most of our assisted living communities have not, but it's going to be hard to tell. And before I pass it back over to Jeannie to talk, I do want to share one really bright thing with you guys. I have 2 clients who are in their late 80s who both have COVID right now. One was diagnosed last week, one was diagnosed 2 weeks ago, and they both are doing fantastic. Very, very, very minor symptoms. So although both of these women are frail and are considered, frail and elderly, and they have a lot of comorbid conditions, they're both actually doing really well and have had mild fevers, have had some increased fatigue, but no breathing difficulties, and both look like they're going to be on the mend to survive COVID despite everything else that's going on in their bodies. So it's not all bad news when it comes to COVID, and I just wanted to end on that bright spot that luckily there are some folks who are getting COVID and despite all the odds are getting through it just fine. So Jeannie, I'm really interested to hear what you have to say and what you have to share with us.
Thanks. I'm Jeannie Christian, and I work for an elder law firm, Brandon Napier Elder Law. And I'm always talking to you guys about the 3 documents we all need: a will, financial power of attorney, and advance directive for healthcare. And then instead of telling y'all sort of the same old stuff, I'm going to highlight why I think a couple of those documents are super important right now. So your advance directive for healthcare, we used to call it the living will, or the medical power of attorney, and the financial power of attorney are called incapacity planning documents. I always think incapacity is something that I just think it's complicated. So it's just something you use before you die in case you're not able to speak for yourself. So I keep thinking about the financial power of attorney and how important that is. If my adult son was furloughed right now and was not able to make his mortgage payment, and he knew that, but missed a mortgage payment, was going into his second month and might not get to pay that second mortgage payment, and then he got sick with COVID, and they went into the hospital on a ventilator, someone needs to step in for him to talk to the mortgage company, to call them and say, listen, I know he's late. It's okay. He has a plan. He was furloughed because of COVID. You might even be able to talk to them. But if you do not have his financial power of attorney, if you're not the agent, the designated responsible party on his financial power of attorney, you cannot call the mortgage company and advocate for him. And there are so many scenarios like that. So many people are in the hospital for 4 to 6 weeks. Well, a lot of bills come due before 6 weeks, right? They come due within 30 days, and people need help stepping in. So if you have an adult child or an adult friend that you think, I better be their responsible party. Sometimes, adult friends, if they don't have other family members, kind of do it for each other. I'll do it for you, you do it for me. But it's really important to have somebody to be able to step in and help out. The other thing, it's funny, I sing this song all the time. We all need to have an advance directive for healthcare. And Georgia combined that medical power of attorney and the living will together, and that's the document. It's a free document online, and it's really specific, lots of complicated things. The 3 things I just want to remind you today is, if you put someone's name on the front page who can be your representative, then they can speak for you. Super easy. If that's all you did today was print that out, put the name on it, and had 2 people witness it, you don't need a notary. You've got somebody to speak for you when you're in the hospital. But you probably also want to go ahead and decide whether you want to be buried or cremated. And that's where you can notate that. And then you also may want to decide about ventilators. So this form did not foresee a pandemic. It just didn't say, in case of pandemic, you want everything done for you, nothing done for you. You want to have a feeding tube, not a feeding tube. There are all these options you can choose, but it doesn't say choose these things whether you have a pandemic, if it's a weird illness. So my personal preference is I don't want to have ventilators used if I'm ill, but I've changed my mind for COVID because people are coming off of a ventilator in 4 to 6 weeks, and it's a real thing that people are getting better from. So I had the conversation. I noted that in the last section of my advanced directive, really specific notes. But then I had the conversation with my family, and I said, I know I always tell you I'm going to be really mad if I wake up and I'm on a ventilator. Don't do it. But in this case, it's okay. And the form is super important because you're probably not going to be in the hospital in there speaking with them, saying, I'm the family member, I'm the person who can advocate. So having that form is really important so that someone else can speak for you. If it's your adult, talk that to her so that the hospital knows who they can talk to. A lot of times you can give it to your doctor, and we can walk you through all the different places where you can have that form. But among all the documents, I definitely want you guys to prioritize that during this time of COVID, just so you guys can have your plans together as you're facing all these things. So I'm happy to take questions at the end, and I hope those little nuggets are helpful. And Logan.
Thank you, Jeannie. You made me think of so many of my clients. I know I end up sending everybody over your way because I'm a financial advisor with Edward Jones, and I work in partnership with my clients and their families throughout their lifetimes. One of the things that I always talk to you guys when I'm there at the senior center about is we talk about making sure that the money lasts for as long as you live. But at this time, one of the very important pieces of the puzzle is who's going to make sure that the money is spent for your health if you can't speak for yourself for a time. And so that financial power of attorney becomes very important. And we've been going through, and some of my clients who were putting it off, I know have been in touch with you over the last few weeks for that very reason. So perhaps that's something positive that'll come out of this time. Right now, we have so many changes going on in the financial world that I wanted to take just a moment to remind everyone that your finances were set up for this. This change in the stock market and the kinds of changes that you're seeing in your financial statements, if you have some invested money, are something that we plan for with our clients. So I work together with my clients to understand what's most important to them. We look at their long-term goals, and then we make sure that the money is set up to weather the storm when there is a bear market like we have now, a recession like the one that we have had to create in order to protect everyone's health. And the other thing that I get to do that's very enjoyable is to not just remind people of their long-term goals and be sure that they're on track, but I get to help them take advantage of opportunities. And right now we do have some opportunities to make money as the market begins to recover in early 2021. And so what I would say to you today is if you have not heard from your financial advisor and you would like somebody to look with you at your statement, if you're concerned about your recent statement, please let me know. I will look with you at your statement. It doesn't cost anything. And I've been going through client statements regularly during this time to make sure that people understand where their investments are and where they're stronger and where they can do better in the coming 6 months. One of the real benefits that we got at the beginning of 2020 is that they moved the required minimum distribution back from 70.5 back to 72. And then this year, with the CARES Act, when that went into effect, they removed the required minimum distribution for 2020 altogether. So that is a great opportunity if you're set up to take advantage of it. If you're not quite sure, talk to your financial advisor or ask me. I'm always happy to help. But being able to skip can be a big tax savings for people. And so if you are in a position to skip it in 2020, this is a good benefit that they've put in place. This year has brought some other changes, and they may be of benefit to your children. So before you loan them money out of your retirement income, be sure and check to see if they can take advantage of other aspects of the CARES Act. They have the opportunity to borrow against their own retirement savings, for example, in a tax preferred way this year. And that can be something that can really protect you and your whole family by really taking advantage of those CARES Act options. So I would encourage everybody to really understand the CARES Act. If you did not receive, I sent out a CARES Act summary, and I know that Victoria sent something out as well. If you'd like a pretty succinct list, or if you'd like to have somebody answer your questions about the CARES Act that went into effect in March, I'm happy to do that. It's very specific to people's individual situations. So whenever I talk about financial, my answer to almost every question is, it depends. It still depends, but there are lots of benefits that have been put in place for everyone. So keep those long-term goals in mind. Most people are not invested in the stock market exactly as it's reported on TV. So turn down the news and tune into more enjoyable programming from the Senior Center. And we'll be here to help with questions. And so I think it's time for me to turn it over. Jeannie, were you going to check and see if people had questions?
Yeah, I don't see any on the chat. So if you want to open it up to questions and recognize people's hands. Yeah.
Okay. If folks have questions, you can wave your hand like this if we can see you, or you can type it into the chat if you'd like to. You can also, what can they do, Jeannie, to raise their hand if they want to?
They can go to reactions, but I think I'm going to that. I think it'll be, I don't think it's worth messing with. Sometimes the hand stays up the whole time.
Okay.
Oh, so Fred is asking, when will the center open again? I know it's a huge question. So the three of us do not work at the center, but from what I understand from Victoria, it'll probably be a while before DeKalb County gives them permission to open up the center again. But I don't know if she has more information and has a plan for sharing that with you guys at some point. But I know we're all looking forward to being able to get back to normal at some point, huh?
Do I see Victoria on this?
There is a Victoria. I don't know if it's the Victoria, but there's a.
Be there, Fred. I'm looking forward to it.
Oh, and then Linda asked, what is the address of the Atlanta Urgent Care Center? So it is tricky. It's right across the street from the IHOP. So everybody knows.
I will look that up.
Okay. And it is right next to a Piedmont Urgent Care Center. So it is a little tricky, but it's right across the street from the IHOP, in between the Hallmark and the QT right there.
Joanne has a question.
Yeah, I have their address right here.
What a wealth of information.
2738 Claremont Road in the QT station parking lot. Their phone number is 678-805-7981.
That's great. And they really were fantastic. I called them ahead of time, asked questions. Victoria is actually the one who helped guide me to their location and recommended it. And they were fantastic.
I have a question, a comment.
Okay.
I had an appointment with my doctor by phone, by telemedicine. So you don't even have to leave your house.
That's good.
So I don't know if most of the established doctors are going to do that.
Mm-hmm. And somebody asked, how is TeleMed services paid for? Are co-payments applicable? There's a lot of information that I find very confusing about that right now. So I don't know if Jeannie or Logan or anybody else has a clearer answer. When the CARES Act was passed, what I understood is that telemedicine was going to be covered by Medicare as well as by most private insurance companies. And that then in addition to it being a covered service now through Medicare, that they were also going to waive the co-payments. But I never got clear on if that was only if the telemedicine visit was related to COVID or if this is for all telemed services, period. Does anybody else have information or clarification on that? Yeah.
So we can find out. We can call Keith Nab.
It's a good idea. So Keith with Affordable Medicare Solutions, who now has his own representative here in Decatur, and she's wonderful. So Affordable Medicare Solutions is a great idea to reach out to and get some extra information. Go ahead, Bonnie.
Hi.
Oh.
Logan, what's the name of your law office and how do we get in touch with you about financial concerns, legal concerns?
For legal concerns, you want Jeannie Christian.
Okay.
And so for investment accounts, it would be me. But
yes,
Jeannie Christian.
Okay.
And
I have a financial advisor. I just would like some help with a will.
Oh, good. Yep. That would be me. If you give me your
question. Okay, what's your information, Jeannie?
404-821-0500.
Okay.
And the other thing to know for everybody is that Victoria has definitely encouraged y'all, any follow-up questions you have, feel free to email her and then she'll help connect you with us and get the question and answer as well. So if after you hang up, you think, wait, who is that? Who is that person? What was their contact information? Feel free to reach out to Victoria and she'll make sure that your questions get answered and you get plugged in.
Okay, one more quick question. Was it a Dr. Herrera who was at that urgent care center?
Herrera,
Herrera, okay, thank
I have
you.
a question.
Okay.
Do you know if the federal thrift savings plan distribution is affected by the CARES Act, or is that not a minimum distribution type thing? Or don't you have any idea?
That's definitely a Logan question.
I'm sorry, I didn't hear the beginning of it.
The federal thrift savings plan. Are you familiar with it?
Yes.
Is the distribution from that affected by the CARES Act? Is that the same type of plan, or is that somehow just a pension distribution, like your pension payment?
From your thrift savings, you typically will have some pre-tax money that is in your thrift savings, but there can be different kinds of accounts inside of that. But if you do have to take a certain amount each year from that thrift savings plan, you don't have to take it in 2020. So it may be something to ask your advisor that helps you with that, or I can take a look at it if you'd like to.
Nobody helps me with that. I've had it since the beginning of time.
Sorry?
I mean, nobody helps me with that. it's just something I get every month, like I get from Social Security, and I'm really not sure what kind of thing it is.
Yeah. Yeah, your thrift savings plan money is, technically speaking, it's a managed account. It's a retirement account, and there should be a number for you to get help from them. I would give you answers and help you with your questions. I don't charge to do that. I don't want you guys not to have anybody help you.
How did you say how to get in touch with you?
You can call me. My office number here is 404 869 0379.
Yeah, it is funny. I mean, there are various things that you do every year, and who the heck knows what they are?
It's a good point.
You know, this is 15 years later. I don't remember.
That's right.
It's true, and if we don't need to take that money, it can really help us with our taxes.
Right.
And so it is important to either know what the heck is going on with those, which most people do not, or have somebody that's actively helping you with it.
I can't see your name. For some reason, I can't get this
Oh,
chat.
my name is Logan,
Okay,
Logan.
Okay, I got it.
And Logan, on that same line, Fred has a question that's related. I'll let you
Okay.
talk, Fred.
Yeah, I just wanted to know if you could address for the group the ability to direct RMD distributions to charities to avoid tax consequences.
Absolutely. Your qualified charitable distribution is not changed by the CARES Act. So if you normally do that and you want to be able to take that deduction or move that money with no taxes this year, you can still do it. So Fred is talking about the option to move money directly from your retirement account over to a charity so that you're not taxed on that money that comes out, and the charity doesn't have to pay the taxes either. So it's a great way to make a contribution. Does that answer your question, Fred?
Yes, I've already done my RMDs, and for a number of years, I've been making my church contributions through my RMD and making my money that I give to IMCA and other charities. And it keeps me from getting into a bracket creep situation where my income goes up and then subsequently you get a higher tax bracket. And I think a lot of people aren't aware of that, so I thought I'd bring it up.
It's such a great option.
And it looks like Jean has a question. Or Jeannie?
If you don't have to take a distribution this year, though, so isn't it a wash?
It's certainly up to you. Some folks tell me that there is a certain charitable commitment that they just want
right.
to make.
They want to do it anyway.
Yeah.
This is Nancy Vandiver. I have my camera doesn't work. You can't see me, but I have a question for Jeannie Christian. What is the website to print out the new living will that incorporates the medical power of attorney?
Right, it is on the Georgia Department for Community Affairs, Michelle. I think I should email that to Victoria so you can have it as a link. That way there's no mistaking. So I will email that to Victoria right after this. And I think that's the most direct way for you to get it, if that's okay.
That's good. I already have a living will, but it's not updated. So I wanted to get a new copy. All right, thank you.
That's great. Let's see, it looks like Joanne. Is it Joanne or Joan? Joanne, okay. I no longer have a primary care physician as mine closed their practice in March. How does one go about finding a new primary care doc at this particular time? Emory never even sent me a letter alerting me or suggesting what to do. I'm in the exact same boat. Maybe we were even seeing the same doctor. My doctor moved to Marietta from Decatur, and I'm in the exact same boat, and I have a prescription that's about to run out. So what are we gonna do? I don't know. I think I'm gonna reach out to that Atlanta urgent care and just see if until we can get established with a primary care physician, if they'll do some of the follow-up stuff, any questions that might be popping up over the next few months, if they'll rewrite my prescription that I've been on for the last 3 or 4 years, and just hope that it works out. Now, in your case, Joanne, did the office, are they still there? Like, did she or he pass the practice on to somebody else?
No,
They're just gone.
Oh my
they're all gone, all 3 of them.
Was that Oak Grove location that had
Yeah.
so many doctors that I saw that on Facebook where there was, I mean, because they were really loved and then they just disappeared, right?
Right.
Yeah.
I mean,
I'm
I
so
knew
sorry.
it was going to happen, but I didn't think it was going to happen this soon and at this particular time.
Yeah.
And you can't contact them?
No.
I think they all left, and so there's
Yeah.
so you can go out to some of the other Emory primary care clinics, but some of them aren't taking new clients right now. I think the state is just opening back up for us to start doing more in-person doctor visits. But if that's something you don't prefer right now, if you'd like to not go into a doctor's office, like, can you get established with a primary care doctor through telemedicine right now?
Right.
I think that we can't. My tendency is to think that they're not going to take on new clients via telemedicine right now.
Hey,
And
Michelle,
so, yeah, you have a thought?
there's one exception to that for
What's that?
So first care management is
Good idea.
right. They are taking new patients, so they go to people's homes. They have nurse practitioners, and so we can definitely get that same information to you. And they're willing to take a brand new client and bring you on, even if you started with a COVID test and they became your doctor. So
Who is that?
first care management.
Mm-hmm. That's a good point. I'm glad you brought that up.
Management.
And so their model is to provide in-home services, and they are setting up people through telemedicine. Is that what you're saying, Jeannie?
Yeah. Mm-hmm.
Okay. That's
Would
a
the
really good point.
pharmacy renew it? I'm sure it's not the first time they've heard the story from his patients.
Well, you'd really talk to the insurance company, wouldn't you?
Yeah, we'll see. And then and Jean, I think your hand is still raised. Do you want to say something? I've unmuted you if you want to say something.
Oh, are you talking to me?
Yes.
Oh, I just joined and was just traveling around my phone trying to figure out where you were.
Okay.
So and it said raise your hand.
Fun. Okay, good. Just want to make sure that your question didn't go unaddressed.
It looked like we had one typed in by Janet. That says, I have minimal investments in a mutual fund. Someone advised me to sell them and buy others so I could take a significant reduction in taxes. Is this a valid thing to do? And the answer is, sorry guys, it depends. But yes, it really could be a valid thing to do. There are always tax considerations when you're going to sell. And there are certainly investment considerations related to making a big sale right now. So just be sure that the person that you're working with really understands what's important to you and what your long-term plan is when they're giving you that advice.
That's great. We have a couple more comments in the chat, and then I guess we should close up because there's another event happening right at 12:30 that they need the Zoom account for. You guys might be attending as well. Linda asked if we have printed contact information that can be provided, and I think what we can do is make sure that Victoria has all of our information to send out along with the advanced directive and first care management's information. Victoria also let me know that Keith Nab with Affordable Medicare Solutions will be doing a virtual session for everybody. So some of these insurance questions you can definitely get addressed with Keith when he's on next. And then Fred added that I think you can go to the Emory website and use Find a Doctor feature to find a primary care doctor. That's a great idea. What I've heard, and I don't know if this is just in the geriatrics clinic, but I know that the geriatric doctors through Emory aren't even setting up appointments for new patients. Because we had Dr. Footman is over in Tucker, and she is fantastic. And I had a couple of clients who were trying to reach out to her to get established, and they won't even set up an appointment. They're like, sorry, you'll have to call us after we get done with this. But outside of Emory's geriatrics clinic, maybe the primary care doctors are setting up appointments, hopefully. We've got to be a little bit more nimble, right? And then, and I guess that's it for us. This was recorded, and so we'll make sure that this gets posted and shared for everybody. And we'll send the follow-up information to Victoria so that she can send out. So if you have any other follow-up questions or concerns, feel free to reach out to any of us anytime. And it was so great to see you guys.
Thank you.
Thank you.
Hi, guys.
Bye, everybody. Stay safe.
Bye.
Bye. See you soon, I hope, in person.
Put your mask on.
That's right.
Stay safe. Stay healthy.
Bye.
Bye, everybody.